This is Dr. Stephen Marsh. You're a general and cosmetic dentist. You do a lot of work. A lot of people come and see you.
Yeah, and you know, Joe, actually some of the segments we've done have prompted people to come. But beyond that, I love to focus on cosmetic dentistry. And a lot of people have events or that sort of thing that they want to make themselves look better. And recently I've had a lot of patients who've come in and said they've taken care of their family, whatever, friends, and now it's their time.
Right.
Many of them are in the 50 and over category. It's not limited to that.
That's awesome.
And for us, it's very gratifying.
Now it's my turn.
That's what we hear all the time.
And we're going to meet some patients right now. You're going to take us on their journeys.
Yeah, thanks. And that's a good way to say it. In fact, it is a journey.
Yeah.
So our first patient is Lisa. Lisa's about 50 years old. She had some dental work done many years ago. She had an old crown in the front. She's been walking around, Joe, with that broken front tooth, she said, for about 10 years.
Oh, wow.
When she was with people, she didn't smile. And she said, let's focus on the upper front. So we did. We actually did some combination of veneers and crowns to give her a smile, Joe. She said she loves going out. We reshaped the lower, and her next treat for herself will be to do the lowers when she's ready.
So that's great. You can do it in steps.
Yeah, and that's what many people ask for, and we're glad to accommodate them, however it works for them, sort of non-judgmental. And so Michael's in his 60s, and it was another thing where he raised his family, and now he's in his 60s, and he said he's semi-retired. He's put away some dollars for that, and he sees this, as he told me, as an investment. And so we actually started in the upper arch, and Joe, though you can only see the front six, we actually did all the teeth in his upper arch.
Wow.
And next year, he's going to go on to the lower, and he said, I feel proud of myself, and when I sit across from my wife at dinner, it's a big difference.
Congratulations, Michael.
Yeah. So let's talk about Denise. So Denise actually had bonding. When you look at her upper front teeth, those teeth were bonded, Joe, a number of years ago, and she's never been really thrilled with it. She said it looks very artificial. And her sister was a patient and said, when you're ready, I think we have the dentist or the office for you. And so she made an appointment, and we looked at options. And bonding, in some cases, works well, but in this case, as you can see, that artificial look that she talked about was something we thought we could only improve doing porcelain veneers. So we started with 8 porcelain veneers. She's trying to get used to smiling. She said she loves it, but she's not used to it. She actually covered up the bonding.
Yeah.
So when somebody comes to us with that and said for all these years it's bothered them, it means a lot to us. And the last one is Noel, and I have to tell you, Joe, we've actually become friends during this process. He was someone that I mentioned that had actually seen one of our segments a number of years ago, and he said, when I get my daughter through college and his wife through graduate school, he's going to come get his teeth done. And actually, he said he was inspired by one of our segments, and we did his entire upper arch. And he said, I feel so different. And now when I do sit across from my wife, I feel so happy with who I am. And she's proud of me having taken care of her. And now it was my turn. So I loved what he had said.
It's probably one of the most dramatic transformations we've seen with Noel.
Yeah, and it's interesting because he had said, had you ever seen someone like me? Well, I've been practicing 47 years now. And I had, but he was such a kind, gentle man who really worried about his family, that to be part of his journey, as you referred to it, it made us feel so good.
It takes one to know one, too.
Oh, thanks. That's very kind of you.
Well, maybe it's your turn. Let Dr. Marsh and his team take care of you and give you that smile you've always wanted. Simply call them at 440-461-1003 or log on to their website, clevelandsmiles.com. Dr. Marsh, as always, thank you so much.
My pleasure, Joe.